Healthcare reform is the talk of the town in Washington right now, over on the House side especially. And the Republicans are slated to debate and take up and finally vote on their package over on the House side tomorrow. We are engaged in that process, and again, the reforms that the Republicans are pushing, not really an overhaul per se, a completely elimination of Obamacare or the Affordable Care Act, whatever you want to call it. Some changes here and there, the removal of the individual mandate, the removal of a lot of different pieces of taxes that the drafters of the Affordable Care Act used to pay for some of the things that they had done, a change in how the subsidy structure works for individuals that qualify for those who utilize the health insurance exchange marketplace, and a couple of other things in there. There still are some issues, I think, from our standpoint when it comes to the health insurance mandates that exist, or what plans should and should not include. There's some concerns that we have in terms of some of the requirements on health insurance companies that lead to some higher costs. Those are still issues that we have, but one of the things that we are trying to do, and hopefully all of you saw this, even though the House is going to vote on this tomorrow, this thing has a long way to go. And so we are still trying to gather information from our membership. And so we sent out a very large email blast yesterday, a survey trying to gather as much information as we can from the membership as to what you all think about this particular proposal. So it updates some things that we had done a few years ago when health insurance, healthcare reform was being debated. And so you'll see some basic questions on there. But we're trying to see, roughly what folks are paying for health insurance today, what type of coverage you have, where you get your health insurance, and then, goes into the newer part as to what you think this type of plan will have, and how you think it'll impact you. So really a big plug for that survey. We've had an extraordinarily good turnout so far, but if you have not taken that survey, please, we'd encourage you to do so. You can, if you did not get an email from us, you can go onto our website, www.nefb.org. You click Take Action on there, and you will see a survey campaign, and that'll take you to the health insurance survey that we have. So I definitely would plug that. We're going to keep this going for a week or two to try to get as many folks as we can to fill it out. We keep getting new responses every day, so please do that for us to help us get a better idea as to what you all think about this new change, and what you all think about how this thing will impact you.